When visiting a physician, often he or she will check your vital signs when examining your health. But when diagnosing irritable bowel syndrome, one local physician relies on an instrument that is not found in the medicine bag. We find out more in today's Health Matters. Whether it's watching TV, listening to an iPod, or having a conversation, we rely on ears to hear, and so do physicians.
Listening. The formula is listening.
Gastroenterologist Dr. Michael Bays uses his ears to help diagnose patients with irritable bowel syndrome, or IBS.
It's not a checklist. You can't come in with irritable bowel and say, I have irritable bowel, and say, okay, here's your prescription. Great. You have to listen to what's wrong with the patient, and you have to try to figure out what's the best way to approach that.
Dr. Bays focuses his ears on three main patient complaints in order to help them find relief. The first, bloating.
If I listen and I hear bloating is the primary problem, then bloating is produced by bacteria. So I try to attack the bacteria aspect of this by giving a course of an antibiotic and following it consistently with a good, healthy probiotic.
Contraction problems in the muscles of the intestinal system can also be a symptom of IBS.
Motility. If I hear motility, then I will try to give them something that will slow down the activity of the bowel so that and we have a number of different medications that will do that.
The third complaint, constipation.
And the more they have in their colon, the more uncomfortable they are. So the more constipation they have, the more uncomfortable they are. Everyone says fiber. If you're constipated, fiber, fiber, fiber. If you're not moving your bowels and you're jamming in fiber from the top end, you're just getting bloated and distended and uncomfortable.
Since IBS affects people in different ways, it's very important to share your experience with your physician. Reporting for Lee Memorial Health System, I'm John Bafar. Persistent diarrhea can also be a possible sign of IBS.